Yeah, so basically that's the worst case scenario, that you will have structural damage and you'll have to have a cornea transplant. However, the surgeon said that pretty much never happens. It's less than a 1% chance that will happen, because that you've had the scans beforehand and they've made sure that you are a suitable candidate. Other risks are obviously me being only 21, that potentially my script will change in 20 to 30 years' time, and I might need a touch-up of that procedure. However, being that I am 21 and they are saying that I will at least have 20 years on this, I think that that's a good risk. I've been wearing glasses since I was 2 years old. I've wanted to have LASIK eye surgery since I was about 6 or 7 when I first heard about it. I was planning on having one when I was 16. However, the surgeons wouldn't touch me until I turned 21 and had a stable script. That's because the eye is supposed to slow down growing. I've heard that it actually never stops growing, but the speed that it's growing actually stops when you're 21, and you tend to have a more stable script once you turn 21. I've had a stable script for 3 years, so that means it hasn't had any changes for 3 years now. So that also makes me a good candidate. They've also, so you go in on Monday morning, they basically have this chat with you, make sure that you know the risks, blah, blah, blah. Then you go in and they put these drops in your eyes, which are actually supposed to numb it so you won't feel any pain. Then there's this suction thing that goes on your eyeball, so that, and they sticky tape down your eyelashes so that they can't actually get underneath and cause any issues with eyelashes being caught underneath. And the suction thing, I guess, is supposed to keep your eyes still. And then the machine will basically do the rest. I'm told it's completely painless. They've also told me it will only take a couple of minutes per eye. I should be in the total of half an hour for both eyes and recovery and all of that sort of stuff. It's just a half an hour thing done in the surgery at the Canberra Eye Institute. And yeah, so it's just done that day. Yeah, and then basically I will go in the next day and they will just make sure that I'm healing properly, and they'll be able to tell me whether I can drive that afternoon or whether I'll have to wait until the following day. But definitely by the following day I'll be able to drive. But you're actually not supposed to go back to normal duties for a week. Pretty much stay inside for a week. And that's mainly because of sunlight. The sunlight can actually damage the work that they've done in the retina. For the next 12 months, you'll have to wear sunglasses when you're outside, just to protect the retina and the cornea from any sun damage. I won't be able to go swimming for a couple of weeks. I think maybe even a month. I won't be able to rub my eyes anymore, and they will actually give me goggles to wear for the first week while I'm sleeping, so I don't rub my eyes while I'm sleeping. You can't, when you get out, put water pressure on there or any sort of pressure. So, when you're having a shower, it's okay to have a shower, but make sure that the faucet's not going directly onto your face. I obviously won't be able to do any sort of contact sports for a number of weeks, even I think a couple of months, until basically they make sure that the bit that they cut has suction down properly. Obviously that means ball sports or anything like that are out in case something hits you in the face. But after a week, you're pretty much back to normal duties. You can go to work and you could do running or those sorts of exercises, but not really sports or contact sports. Yeah, and so I will keep you posted on how it went. Have a good afternoon.